Good morning, everyone. First of all, I would like to congratulate all the awardees, and one of them was old from Madurai, and I don't know whether you're a student or I don't remember. Okay. And I would like to thank the chairman, the secretary, and the organizing committee to give me this great honor being a guest today. And another focus, I'm really happy to note that the focus this year was Neuro Ophthalmology and motility disorder. So I became a Neuro Ophthalmologist, and everyone was looking at me in a very, very pathetic face 40 years back. And still, the specialty is not very well known. Whether the ophthalmologist should become a neurologist or the neurologist should become a neuro-ophthalmologist, still it's a debate. I've retired now from an active neuro-ophthalmic practice 10 years back. So I'm going to give you a small comprehensive, maybe repetitive, and I'm in a very big position today. I'm a farmer, organic farming. I enjoy. Anybody wants to join, we can give you 3 meals a day. Now, basically, I want the neurologist and the neurosurgeon or the ophthalmologist. I don't know how many ophthalmologists are there today. Can you raise your hands? Very few, isn't it? Why one side? Why not scattered? Okay. So this neuro-ophthalmology is a very, very beautiful, close to my heart because of the following reasons. One, the eyes or the windows for the body. Every specialty in the body is attached to some way related to the eye, whether it is an obstetrics gynecology or medicine, surgery, neurology, neurosurgery, ortho, from blowout fractures. So everything we are the windows, not only for the body, but also for the soul. You can get into the soul, a teenager get into a soul, or a man with a spiritual mind. So it's actually a window for the entire body and the great soul. Now, as I said just now, any general ophthalmologist with some interest can take up this field and guide the neurologist and the neurosurgeon in localizing the lesion, lateralizing the lesion, gives a prognostic approach to the lesion if they are interested. So we can help in getting back the vision or saving the vision or saving the life of the person. Now, how close we are to the brain? Actually, we are the only people, we are very, very close. Can we call first cousins or a partner or anything? One, we are closely associated anatomically. We are closely connected through the physiological connections. And we share the common blood supply to the brain and the eye. And we also share the same venous drainage. And out of 12 cranial nerves, 6 of them belong to the ophthalmologist. So what else you need to be so closer? Now, as I always think, God has rented a place in the entire brain. And what you see externally as an eyeball is not the eye, ophthalmology alone. In the whole system of the eye, the visual pathway and all our systems are rented inside the brain, which is extending from frontal lobe to the occipital lobe. Can you imagine any lobe is not omitted? Olfactory lobe, frontal, parietal, temporal, occipital, midbrain structures, and the cellular regions. Any place our heroines is there. Now, when you talk about this, now if you imagine without the visual pathway, the base of the brain is empty. If you see, you imagine this picture in the subsequent talks. So the chiasma look, the optic nerve, the tract, the radiation, the lateral genicular body, and the occipital cortex are so imprinted at the base of the brain. So any lesion in the brain will involve the eye structure in some form or other. Now, physiologically, we are also connected with all the physiological systems, ganglion cells, and all the plexus, sympathetic, parasympathetic. So physiologically, we are well connected. And coming to the blood supply, there are only two systems, the carotid system and the vertebrovascular system. We also, for ophthalmologists, that's only two systems supplied to us, whether it's a central little artery or any the cavernous sinus drainage. If you look, the cellular region, the middle, the base, the chiasma is hugged by the two internal carotid arteries. So imagine any aneurysm or a leak or a compression of the internal carotid artery or antecerebral or anti-communicating or a post-communicating artery in the form of ischemia, sclerosis, hemorrhage, aneurysms or compression will involve definitely the chiasma, which will reflect in the form of either a fundus pathology or a field pathology. So if you know the anatomy, you can locate any lesion in the brain. Now again, I just want to focus. The two internal carotid artery connect with the circle of Willis in the brain, and that is the area our key structures are there. Chiasm is a quadrilateral structure where the crossed fibers and of the nasal fiber and the temporal fibers which